Good evening. Welcome to Black Video News Network and our weekly podcast, Press Play. I'm your host, Cedric Fisher, Executive Director for Black Book Studios. Happy Friday. It's May 1st. This is May Day, right? Is that what they call it? May Day?
Yes, May Day.
May Day, May 1st. We are moving through the year rapidly. And of course, this podcast is, the recent series has been dedicated to COVID-19, the coronavirus, and all the ways that it's impacting the African American community. Of course, this is disproportionately impacting us, so we have to kind of speak a certain language or at least share things that would be important to us that maybe the greater community is not talking about. And the good news is this week the mayor and and Judge Wolf have relaxed some of the current restrictions. They currently, retailers now, restaurants, theaters can open up their facilities to 25% capacity. And I think a lot of folks who have hit points of mental fatigue are in a hurry or a rush to get out and go have a meal now outside their homes, go see a movie outside their homes. Of course, Netflix and YouTube and all the other movie streaming channels have had a field day, and now I guess it's time to inch our way back to normal. So my question for the African American community is, what are we going to do? Again, the restrictions have been relaxed, and now we can go back to normal. Well, maybe not. Let me give you some statistics here. We're going to catch you up on how the virus is affecting the country, and then we'll bring it home to our neighborhood right here in Bexar County, Texas. So recently, this week, the American Medical Association, who, by the way, has the first African-American CEO in their history, 111-year history, that's a great milestone, did a town hall with the NAACP and the National Medical Association. American Medical Association is all the MDs in the country, whatever nationality, ethnicity. The National Medical Association is the largest and oldest assembly of African American MDs. I think it includes doctors too, dentists too. Anyhow, it was determined that 13% of the country is African American. However, 30% of those infected by the coronavirus happen to be African American. So the current numbers are, there are over 1 million, about 1.2 million Americans infected with COVID-19, 61,000 deaths. And that was the numbers up till, I think, yesterday evening. Could be more as I speak. However, in certain markets, again, we're 30% of the general national number, but in certain markets, we're almost 80%. Case in point, in Washington, D.C., 8 out of every 10 fatality for coronavirus is Black. It's 81%. In Georgia, it's 81%. In New Orleans, 74%. And in Detroit, it's over 70%. So we're talking 7 out of 10, 8 out of 10 of all the deaths in the major markets happen to be Black folks. And this is why, even though our current leadership is giving somewhat a blanket release or relief from all the restrictions, we have to pay a little closer attention to make sure we still are abiding by some of the most important things that we have to do to protect ourselves. So I wanted to go through real quickly here a series of some of the reasons why we may be disproportionately impacted by this virus. You've heard these before, but it bears repeating because this is important. And again, a lot of these are notes I took from the town hall meeting this week. The number one reason why this disproportionately impacted our community was misinformation. Early on, there was a rumor out that African Americans couldn't get this disease. We were immune to it for some reason, and we wouldn't get it. So we were slow to get with protecting ourselves from the disease. That's the big number one reason. Number two, pre-existing conditions. Conditions like diabetes, hypertension, asthma, COPD, mental health, and our diets, the food we eat, are reasons why we became targets for this particular disease. Again, it was looking for low or compromised immune systems. Number three, social determinants of health. What do we mean by that? One, we're twice as likely to be uninsured. Most African Americans in this country don't have health insurance. So as a result, we're slow to go see the doctor, follow through with diagnosis or whatever they tell us to do, go get the prescriptions filled. We are underinsured. Two, wealth gap equals a health gap. If you don't have money or resources to do a lot of things, you really can't take good care of your health. It's a big deal. Number three, employment. A large percentage of the frontline workers, right, or what were folks that were called essential employees, tend to be people of color. And as a result, we didn't have the luxury to kind of tuck in and do the stay home and social distancing and self-isolation that was requested or required by the leadership. And so we had to go to work during the pandemic. Number four, race. Of course, we know, most of us that have been around long enough, we know race is always a big issue when anything happens on a national basis. Number five, the economic impact of healthcare medical provider, the economic impact of the healthcare medical provider community. What's that mean? A lot of smaller clinics, MDs in maybe rural areas had to shut down. The economic impact of the virus just left them in a situation where they either had to furlough or lay off staff, or some had to completely shut down. And their patient load or network that they were accustomed to seeing had no physician to go see. Again, in a lot of rural areas, they don't have real sophisticated health programs and hospitals to go to. Some of the doctors, physicians still have to make house calls, and when they couldn't either go see someone or someone come see them, that became a big problem. Number six, and this is a big one for communities of color, social distancing and self-isolation. Now, many of the homes in our communities have 3 or 4 generations living together. Okay, we got great grandkids and grandma, 4 or 5 generations in there, and we typically don't have 5-bedroom homes. We're not the vast majority of us aren't living quite that well. So we've got a lot of people in close proximity of each other. When a virus hits the house, it's like a common cold. It just works right around the house and everybody in the house catches it. So that particular restriction we really couldn't do just based on our normal living conditions. A lot of African Americans, again, people of color typically, and I'm also referring to Hispanics and even Middle Eastern Indian folks, will have 3 or 4 generations living in the same home. So what are we going to do? This week, we were all told that we're going to try and get back to life as it once was. We're going to get back to business so we can bring the economy back up, put people back to work. I kind of agree with that. It's time. We need to get busy. Again, people are now hitting mental fatigue. However, we need to continue to do the things that they required us to do the very first time. Wear your mask. Wash your hands. Stay at home as much as you can. I know we're all egging to get out. Claustrophobia has kicked in, cabin fever. We're just itching to go places and get out. And it's beautiful out now. It's warm and it's sunny. So it's good to get out, but just make sure that you maintain your protection. Let's bring it closer to home. Bexar County. All right, our current statistics. We have 1,374 confirmed cases of the coronavirus. It's 48 deaths in our neighborhood. I'm not sure what the breakdown is from ethnicity. I do know the mayor was on CNN last night, and I think they spoke a little bit about the disproportionate impact on the African American community. We still have 55 people that are in the hospital with COVID. 37 are in intensive care. 21 are on ventilators. So there's another 50 people we could potentially lose due to this virus. The city is going to monitor this relieving these restrictions for the next couple of days and see what happens, and then we'll be making adjustments going forward. Although the major focus remains COVID-19, there are other health conditions that are still looming large in our community, and the number one health condition by disproportionate, or what would I say, per capita within people of color is HIV and AIDS. A lot of us don't know that. What a surprise. But that's still the number one condition. And number two would be cancer. All different types of cancer, from prostate to breast cancer, lung cancer, you name it. We are handling these diseases. Another reason why when Corona showed up, we were a natural target, because we have these pre-existing conditions. The third major reason, believe it or not, is kidney disease. We suffer from a lot of kidney disease, and a lot of folks just aren't aware of it. A lot of it, again, has cultural, historic foundations that would take time to really go into why we suffer from these particular diseases. With that, as you know by now, every week when we do this podcast, we like to bring on what we call a subject matter expert on a particular frontline person or frontline response to COVID-19. And this evening we are privileged to have with us Ms. Violetta Mitchell from Beat AIDS.
It is, yes.
From Beat AIDS, right?
Yes, it
All
is.
right, so we're going to talk a little bit about HIV with Violetta, and welcome to the show, Violetta.
Thank you.
So I'm going to ask a series of questions, and by all means, feel free to chime in if I don't ask something that you might want to share with the crowd.
Yes.
First and foremost, tell us about your background and what's your story.
Well, thank you so much for inviting me today. My background, actually born and raised in Panama. So I'm a Black Latino. So I get impact in both ways, in the Black community and the Latino community. I have 5 beautiful
We hear the
young-
accent. It's a great accent, by the way. It's wonderful.
Thank you. I have 5 beautiful young children, 4 boys and a girl. And I'm a grandma of 3 grandkids.
Okay.
My greatest passion in life is to serve others and be a servant of God. That's my passion in life, to give back freely what was given to me by God. So I enjoy doing my job that I presently do these days. So, like you mentioned, I do work at B-Days. I've been working at B-Days since July 16, 2015.
Okay.
So this year will make it 5 years.
5 years.
Yes.
And what's your role there? What exactly do you do?
So my role at this present time, I'm the house manager of a transitional home that we have for ladies. So I'm actually, like you say, at the front line.
Okay.
So I enjoy that very much. And with this epidemic going on, at the house with the ladies is being a challenge.
Okay.
It's being a great challenge.
Big challenge.
Yes.
Describe or just kind of define Beat AIDS. What exactly are you guys? What do you do? You're a nonprofit organization, right?
That is correct.
And what specifically do you do?
Okay, so at Beat AIDS, what we do, we go out and we test for HIV/AIDS and STDs. We do this because we want everyone to know their status. The only way for you to get help, the only way for you to know is getting your status.
Okay.
And you might think that everybody will want to know their status, but it's not easy for someone to walk in and say, I want to get HIV tested. There's a lot of stigma around HIV, so we don't always have everyone coming in and want to get tested. So for that reason, we meet you where you at. If you don't want anyone to see you coming into our office, we will come to you
Okay.
and test you there.
Okay.
Yes.
So you guys are like a mobile unit to go test, or is it a little kit that you take, or do you need to bring people into a van, or?
We do have a mobile unit. We do that when we go out to events, but we also we have the prevention team that will go out in their cars and they will come to you. If you're at the park, if you're in McDonald's, wherever you feel comfortable, we come to you and we have a kit. And getting tested is just as confidential, fast, easy, is a fingerprint. That's all it is. We just stick in your finger, get your blood, you wait 3 minutes, and we give you preliminary results. And that's how we will let you know what your results
So in
are.
3 minutes, a person can get their results back.
3 minutes.
Wow.
Yes,
And you call it a preliminary results.
that is correct.
It's not necessarily the final result.
Correct. It's not necessarily final result because sometimes they have some other issues you might be going through in your system, and they might give you a false result. So if we get a positive result, we will have to send you off to get your blood taken. So now we're gonna get some blood from you, and once the blood tests come back, then it's official.
Okay. So it's kind of like a second opinion.
That is correct.
Good. How is the coronavirus impacting your organization?
It impacted it greatly. Greatly because the clientele that we serve are one of the one with the low immune system, and they was real frightened. They was frightened. They didn't know what to do. They didn't. I mean, it was very tense and stressed out. Our organization never stopped. We didn't shut down. Our doors didn't shut down. Our executive director, Ms. Michelle Dorn, she came up quickly with the team ways how to don't stop working and to continue taking care of the community. So most of us went, and we work from home. And the clinic did not close, but they keep their social distance, always 10 people or less. And we had to have our counselors that we have on site to talk to a lot of the clients to help them understand what was going on and try to keep down the stress and the fear away from them.
Do any of the patients, are they in-house? Are they residents there? Is it that type of a facility, or it's just
Okay, so we have a transitional home,
transitional home? Okay.
and that transitional home is for ladies. We do have presently we have 4 ladies living, and when this started, it was really scary for them. They would tell me, Miss Violet, it's like a movie. It looks like a movie. So we had to try to keep them going every day because they start to get depressed, they start to get stressed out. We had to shut down the facility, no one going out, no one coming in. We had to do everything for them. We had to go grocery shopping for them because we wanted to make sure that they was protected and safe. We didn't want them go out there and being because they have a compromised immune system, we didn't want to put them at risk.
Right.
So we had to become everything for them. Yes.
Have you noticed that some of your patients have contracted coronavirus, or have you guys been able to monitor that at all?
So the
Do you
whole
call them patients or
we call them clients.
clients? Okay.
Yes, we
I'm
call
sorry.
them clients.
I'm
So
getting-
that's
I get
okay.
that.
So from all the clients that I know from our agency, I've not heard of any of them contracting or becoming in contact with anyone with COVID-19. I don't know if you have heard when it first started that they was trying to use HIV medication to try to see if that will work against the COVID-19.
Oh, really? Okay.
Yes.
I didn't hear about
And
that.
yes, and I actually look up information, and you will not find a lot of HIV patient that became contaminated with COVID-19. It is not. I looked it up, and it was saying that in New York, we had the most contamination right now going on. Of everyone that been in contact or with the virus, HIV patients was only 11.
Okay.
Only 11.
So why is that? You think that they naturally started, protecting themselves early before everyone else did, based on the fact that?
So my belief is because a lot of our clients, the HIV clients, take it very seriously to take their medication, and the ones that are able to keep that strict diet, because I remember you saying that was one of the facts, the diet in the Black community.
Right. Yeah.
So they are able to keep up with it because they have to eat well to take their medication. So once taking the medication, it helped the immune system to fight off whatever virus or infection that's trying to come into their body. And because they hear what's going on, they want to stay away because they know, hey, I have a compromised immune system. I don't want to get involved. So a lot of them wasn't trying to be out there. They was trying to stay home. They was trying to follow the rules that was told because they already know I'm already have this going on. I don't need something else to come and attack me and take me out faster than the HIV. So I think a lot of them understood and they protect themselves well.
How about you as one of the workers there? Did you guys do anything unique, different to protect yourselves?
So yes, so we had to follow, or we continue to follow the CDC guideline as far as washing our hands constantly, and we wearing the mask, wearing gloves. Being that I'm the house manager, and knowing that my ladies, the way they felt, I was told that I could work remotely, but I wanted to be there for them. So I will leave my home every morning and go with them, to be with them. And I will wash my hands as soon as I walk in the facility. I will spray myself some Lysol because I want to make sure they are protected.
Okay.
And if anybody came to the door, they was not allowed to come in the building. We meet them at the door, and we talk.
Like that. Okay.
Yes.
You guys wear your mask and everything?
That is
most of
correct.
the time? Okay.
That is even when the mailman came.
Yeah.
We had a sign at the door, please ring the bell. And sometimes we would tell them, like, leave the mail outside, or we would just grab it and we won't give it to the ladies. We will leave it sitting for a day or two, and then we will hand it to them. Yes, that's what we had to do.
So you guys have protected yourselves. Okay.
That is correct.
We are going to take a short break here. As you can see, me and Violetta have our divider up for our social distancing. Here, our great distinguished producer and owner, Carl Booker, built this thing and designed it to make sure we can protect ourselves from any type of possible agent that might be buzzing around. You're watching Press Play. This is Black Video News Network. I'm your host, Cedric Fisher. We're going to take a break. We'll be right back.
Hello, I'm Tony Hendricks, Chief Operating Officer at Lewis Funeral Home. Lewis Funeral Home has been serving San Antonio and surrounding areas for over 100 years. Lewis Funeral Home's ultimate goal is to help those families in their time of need. If your family is ever in need, please feel free to call us at Lewis Funeral Home, 210-227-7281, or check us out on our website at lewisfuneralhome.com.
good, baby.
Is it really all good?
If you love me enough to routinely test your handyman skills, not to mention the strength of your marriage, then of course you'll visit nhtsa.gov/therightseat to make sure I'm in the right car seat.
With coronavirus spreading, people at higher risk must take extra precautions. You're at higher risk if you're over 65 or if you have an underlying medical condition. Please visit coronavirus.gov for more information. As the nation's doctor, I often get asked, what should I do if I think I might have coronavirus?
People who are sick should stay home. You don't go to an emergency room, you don't go to a clinic. You get on the phone and you ask for advice and instructions from your physician.
We don't want you to go into the ER or the doctor's office without talking to them first because you might spread coronavirus to someone else. Please visit coronavirus.gov for more information.
1 in 3 adults has prediabetes. Take the risk test at doihaveprediabetes.org. 1 in 3 adults has prediabetes. That means it could be you, your favorite brother, your other brother,
Yes.
you, your football buddy, your football buddy, you, your plumber,
Breathe right into your foot.
your plumber's masseuse,
Yes.
you, your dog walker, your cat jogger. With early diagnosis, prediabetes can be reversed. Take the risk test at doihaveprediabetes.org.
Does your life merit focus?
Welcome back to Press Play. I'm your host, Cedric Fisher. Press Play is your weekly podcast from Black Video News Network. We are a division of Black Book Studios. Blackbookstudios.org is the website, and we have developed a website specifically to talk about all things coronavirus called Black Impact. BlackImpactSAB.org. BlackImpactSAB.org will be all of the resources you'll need for the coronavirus as it relates to the African American market here in Central Texas. And this has been a series of discussions about the frontline workers for coronavirus and folks who are somewhat behind the scenes, taking a very instrumental part in helping to help our community, people of color, understand how we really need to respond and manage through this pandemic. As I mentioned earlier when we came on the show, people are now starting to approach mental fatigue and frustration and depression, and the leadership in the city has now relieved and relaxed some of the restrictions. However, we need to be very careful and cautious that we continue to pay attention to making sure that we're protected, because we are disproportionately or this disease, while other groups may be managing through it, it's killing us. We are leading the league in fatalities and mortality. So we've got to be very careful. And our guest today is Mrs. Violetta Mitchell from Beat AIDS. Beat AIDS is an organization that is doing a phenomenal work, and they're always putting their clients' needs first. Obviously, their client load are folks who currently have AIDS. Is that correct? They have HIV. There's a difference between HIV and AIDS, right?
That is correct.
Okay. And I understand that your organization has been invited to be part of the transition team to get the city back to to work.
That is correct.
Can you talk to us a little bit about what that is, what that means, and how you guys kind of feel about the leadership's direction?
Absolutely. So our executive director, Michelle Doran, she is so passionate about her clients that when they announced that they be opening up soon, she became interested in forming part of the COVID-19 health transitional team. And what this team is doing, they are coming up with different strategies and plans to convince the city council that the opening of the city might have been too soon. So they are working on it. I believe on Wednesday, they sent out their last information and records and showing the numbers and letting them know how it will really affect the community for opening up too soon. So they are working on that. And the team is formed with different doctors, nurses, and they are putting their heads together to see if they're able to listen to them and understand what's really going on.
So thus far, have they really been listening? So you guys are sharing data and that type of information with the mayor's office? And
Correct.
okay,
Yes.
Have they been listening to you guys or making any adjustments based on what you've recommended?
Well, right now you see that they say that right now we're on phase 1, opening up the city. So when I was looking over the information that our executive director shared with us, that is part of their plan, that they must do it in phases, not just open up and send everybody out there. Because really and truly, some of the people that are that have the COVID-19, they don't even know that they have it. And it innocently is out there, and you go around them and you don't know it, and then you end up having it. So they are trying to let them understand that everybody has the symptoms and we need to be more precautious and more, have more safety measures before you open it up the whole entire city.
Yeah.
Yes.
Yeah, that's a real controversial directive, I guess. There's a lot, you got a certain group of people who believe that it's just too premature. We don't have enough information.
Correct.
You have others that are just, again, cabin fever and claustrophobia set in so much, they just want to bust out the seams and go back to normal. They're almost willing to be risky and even somewhat reckless to jump back out there. But I think, and we talk about it often here at Black Book Studios, one of the things that the wild card out there, or the caveat, is mandatory testing. They haven't required everybody to get tested. And to your point,
correct,
there's people walking around out here who probably have it, don't know it. And they're walking around, all sorts of people, and now they go to the theater tomorrow or to a restaurant.
Yes.
And it just turns into somewhat of a disaster. Let's talk about your clients again. So if I needed to get tested during this pandemic, what would I need to do?
Okay, so if you needed to get tested for HIV, you could call our office. The phone number is 210-212-2266. And that is the number for Beat AIDS. We are asking everyone that want to get tested if they have a fever or flu-like symptoms, if they could please contact the COVID-19 or the Metro Health hotline, because we don't want to put anyone at risk. But if you want to get an HIV test, you will contact the Beat AIDS, and we will do the curbside service like everybody else is doing. So we will bring you the test, and we will drop it off or leave it at your door. Okay. Like I said, just prick up the finger, and you will do it yourself and call us back, leave it at your door, and we will come back and we will pick it up, and then we will let you know the results.
So you guys aren't giving the coronavirus test, just
HIV test.
HIV.
That is correct. Not right now. They talking about it in the future, but they hasn't come up with a definitely answer for it. But they thinking about it.
So when you and I'm not asking for trade secrets here, but when you guys get the results back, are there other things in there that you guys find other than HIV, and do you tell the client about that?
Okay,
For
so
example, if someone did have the virus and they took the HIV test, but you discover it, would you tell them that, or?
so we have steps how to do it. The HIV test only will give you result for HIV. We do have STDs test as well too. So you can always be tested for that, and all these tests are free. You don't have to pay for it. And once someone come up preliminary positive, we have steps how to let them know that they are positive. We don't just call them on the phone. We ask them to come in, and we will have the counselor there, and then they will let them know, because I've seen when you give a result, sometimes they break down,
Yeah.
and sometimes they will threat to take their life, and we can't let them go if they say they want to take their life. We have to keep them, and we will have to call the hotline and say we have somebody that is thinking about taking their life, and then we will wait till they come and get them, and then they will be taken over. But sometimes it become very sad.
Yeah,
Yes.
that's a huge moment
It is.
to find out that information. So you mentioned the test is free, but does a client have to have insurance to come see you guys?
No, you don't have to have insurance.
Okay.
At Beat AIDS, you don't have to have any insurance. All tests are free. We do have a clinic, and once someone find out that they are positive, and we do have a clinic, it's named Your Choice Clinic. It's on the south side in South Zamora. And for that clinic, we will, insurance is always welcome. But
Okay.
if you don't have insurance, it's not a reason for us not to take care of you.
Yeah.
So you could come to us even if you don't have insurance.
So you wouldn't turn anyone away?
No, we will not.
Okay,
Everybody is welcome.
right. Okay. Now what was your function again? What's your title? You're the
I'm the house manager
house manager
at the transitional home.
at the transitional home.
Yes.
Okay. Describe that home for us again. So is it purely women? Is it women and kids? If it's family, is it men?
Absolutely. So the transitional home is women's only, and we are not equipped for children at this time, nor men. It's for women's only.
Women, okay?
And the house is not only for HIV positive ladies, it's for women that are affected or infected with HIV. So I want to make that clear, because we don't want everybody to feel like everybody that is there is HIV positive. No. You could be affected by it, meaning that you might have a family member or a friend and you got affected by it, and we are able, if you are homeless, you are able to come stay with us. If you're coming out of prison and you don't have nowhere to go, if we have the room available, we could also house you there with us. We have different programs in the house.
Okay.
Well, we have morning meditation with the ladies. They do their chores. It's just like, having your own place, but we helping you to come back into the community after going through something tragic in your life, like coming out of prison or getting information that now you are positive and you don't know what to do. Because believe it or not, even in this modern time, HIV has a lot of stigma around it. And you will believe where we're in 2020, now a lot of people are still afraid of getting around someone that is HIV positive. So that's the reason we keep it that way in the home. You will know who is positive and who is not, because there's a combination of affected and infected people in the home.
Okay. Is there a certain age limit, or do you have to be 18 and above, or?
Correct.
You do.
18.
Okay.
You got to be 18 and above. You have to be willing to want to make changes in your life, because we are there to help you, walk you through this tunnel and walk you out of that darkness that you've been in for most part of your life. and try to bring you out to the light and help you. We have ladies that came there that didn't have a high school diploma and then left with a GED, and they are going to college. And they leave there and they come in homeless, and they leave having their own place. So we have different programs that we could help you with housing, with your utilities, even like I say, getting your education and bring you back to reality.
Okay, restabilize you,
That is correct.
which is a beautiful thing. What's BEAT stand for, by the way? Is that an acronym for something?
Yes. And B is the Black effort against the threat of AIDS.
So Black effort against the threat of AIDS.
That is correct.
How about that? Okay.
Yes, and our mission for BEAT is to provide the highest quality HIV/AIDS prevention, education, and service to reach out to our community.
Okay.
So that's our mission at BEAT.
So if it's not too personal of a question, what made you interested in joining an organization like this?
So at first, when I was informed by a friend of mine that she worked in the facility, she was working at a transitional home. She never mentioned the BEAT part. She never mentioned that part. So like I've stated at the beginning, my passion always been to give back freely what I receive freely. I always wanted to help. And when she used to come home and talk about the ladies and she want to help the ladies, it broke my heart. And I wanted to be part of it, because you only could help someone if you've been through it. So I know what it feels like not to have a place to live. I know what it feels like not to have enough to feed your family. So I wanted to be part of that, to try to help out. And when I went and got interviewed for the job, I was accepted immediately. And then that's when I learned about the second part about the HIV. And it even become greater. I've become more interested in it, because now you're talking about folks that, are sick and have something, and I just wanted to help.
Yeah. So it was the homeless thing that you were motivated initially by.
Correct.
And then you learned about what they were doing for HIV.
That is correct.
And you really thought, okay, this is some special work.
Yes.
That's good to know. Do you guys accept donations? How are you guys funded?
We are a nonprofit organization.
Okay.
So it's basically run by donation.
Okay.
So donation is always welcome. And I mean, right now in the home for the ladies, we always accept donations, things that they could use, because sometimes we have ladies come in and they only come in with what they have on. Mm-hmm. And we have to start them up from the floor up. So donation is always welcome. Sometimes they come in and they don't have no money. So we have to get them food. We have to get them clothes. We have to get them underclothes. We have to get them toothbrush, toothpaste. So donation is always welcome at
So you guys will welcome monetary donations, or
correct,
other materials and things.
Yes.
Hygiene products.
Hygiene products. Yes.
Okay.
Products.
How would a person donate? How do they get in touch with you? What's the best way?
So to give a donation, they could. We have a website online,
Okay.
and you could go to www.beat.org. At first, we used to name BEAT AIDS, but we took the word AIDS off because of the stigma. So now it's only beat.org, and you could do donations there, or you could call the 210-212-2266, and you will speak to the person that, answer the phone, and they will give you all the information how to do the donations, or especially now that we are COVID-19, how the process, if you want to bring donations to the home, how we will proceed in accepting the donation.
Oh, so there's a specific process even for that now.
Correct. That
because
is correct.
Of Corona.
Yes.
Okay. What was that phone number again? Can you repeat that one more time?
For the donations, it will be 210
Okay.
212-2266, and that's the BEAT number.
And can people walk in off the street to visit or to come see you guys?
That used to be the case before COVID-19.
Yeah.
Walk-ins was always welcome, but because of what we are going through today, we are only taken by appointment only.
Only appointments.
Only
Okay.
appointment. Right now, the house is shut down too, and we are not taking any new ladies to protect the ones that are already there. But they could always call us, and I will put them on the waiting list. And after this is cleared up, then we could proceed to start bringing in more in the residents to the home.
Okay.
Yes,
Violetta Mitchell,
that is correct.
House Manager of Newly Empowered Women Beat AIDS.
Yes.
Thank you for coming to see us today and sharing with our viewing audience the special work you guys are doing on the front lines. We're going to close the show. This is Press Play. I'm your host, Cedric Fisher. Again, we want to encourage each and every one of you to follow the CDC guidelines about protecting yourself throughout this crisis. We believe, we tend to be faith-based, that this too shall pass, but we want to make sure that we can save as many people as possible throughout this, even though the restrictions have been relaxed recently in our city, in our particular market. I want to encourage you guys, be very cautious about how you proceed. Don't rush to get out just because you're tired of being at home and you want to eat a meal that someone else is cooking, or whatever the case is, you want to catch a movie on the big screen. We've got to be very careful. Again, this disease is, this virus is disproportionately impacting our community, and we want to make sure we save as many folks as we can. We'll be back next week, same time, for Press Play. We're a podcast from Black Video News Network. You can find us at blackstudios.org, blackimpactsab.org. That's our all things COVID-19 resource website. We are also marketing thermometers at this point. We can be very helpful in a lot of regards. And of course, if we can be helpful to you, reach out to us. You can email us at info@blackbookstudios.org, and we'll respond to you just as quickly as we can. We look forward to seeing you next time. Stay healthy. Good night.